if we speak about side effects, the most fear of any educated doctor is kidney and hypercalcemia. But if we are right with our hypothesis that there is a quiet form of vitamin D receptor, then it should be that a high dose of vitamin D is not more dangerous than an average vitamin D dose for a non-resistant person. And that's what we see in our population. We have not one in the last 4 years of any kidney failure. We haven't seen it. We have seen a few hypercalcemia only in the lab work, not in clinic symptoms. And what we could publish, a friend of us could publish this in nutrition. He could show that we do no harm to the kidneys. It's the opposite. After a couple of years in the vitamin D protocol, the kidney get better. So it's the total opposite of what our colleagues think. And the kidney data is already published. We published the hypothesis, and our kidney data is very close to publish because we have the same statistics as Professor Amon in Germany with his patients. Yeah. So we think we are right. We think that the resistance is real, and that's why the high dose is not dangerous for our patients. We need to monitor them. That's totally clear. We need every 3 months in the first year. We need lab work. We need kidney parameters. We need PTH, of course, yeah. And we take a lot of stuff every 3 months, and we take a 24-hour urine sample to see how the kidney works, how many calcium is in the urine, how many phosphate and how many protein, yeah. And we see it's very, very cautious monitoring. Here, we could guarantee our patients that we do not harm with the protocol. It's totally the opposite.
When you're monitoring, the parathyroid hormones, the renal function, calcium levels, and so on and so forth, if you ever see a problem, how do you adapt to that? Do you back off the vitamin D dose? Do you change something else?
You mean if we see problems?
Right.
Yes. Okay. Like I mentioned, kidney is normally not the problem. Yeah. What we see temporarily is, like I said before, vitamin D is responsible for detoxification in the bile acid system. So if we treat or start giving the organism the needed dose of vitamin D, detoxification kicks in. And some patients notice that they have some skin issues, like a teenager being in puberty. And what we see in the kidney tissue is that there's a little rise of creatinine. Yeah, but it's temporarily for a couple of months. And then it goes down, and very often better than before. So we think that this is a detoxification progress in the kidney tissue. And when it's finished, the kidney is better to filter than before. And for some people, and especially for those who are having MS for 20 or 30 years, this detoxification is too strong. It's, for example, if you rebuild a house, yes, you buy an old house and you put out the windows and the heater and the floor and everything together, and you still live in the house. You could do that if you're young. Yeah, you could sleep and have a little stuff, yeah, and you don't need heat because you're young. But the old could not. So if a detoxification kicks in for nearly every organ system, that's too much for them. For those guys, we need much lower doses. But after a couple of years working this field, we are very experienced to sense, what we offer, what starting dose to a patient. And the rule is clear: as younger, as higher we could get in, and as older and as longer they have the disease, and the more severe the disease is, the lower the dose is. And very often in these very, very ill patients, we start with something like 20,000 IUs a day, for example.
Outside of MS, because you mentioned that, and I'm just kind of curious as to, you know, if you're seeing remyelination, you know, if you're seeing plaques going away, but what other autoimmune conditions are you seeing success with? Would it be safe to say that all autoimmune conditions could potentially benefit from this?
We we hope that in the beginning that would be insane, and we tried nearly everything. We do not reject any patient. So any freaking autoimmune disease which you see once in a lifetime, we say, well, let's try it. And so now we filter a few ones where it's very, very good treatable. And these are, for example, the chronic intestinal diseases like morbus Crohn and colitis ulcerosa. Are good treatable with vitamin D. The rheumatoid illnesses, polyarthritis, and these rheumatoid lupus erythematosus, for example, is good treatable. Psoriasis could be very easy treatable, but the biggest success is in MS. So for every other autoimmune disease, it's less than in MS. For example, this is a guess because I didn't do a statistic on psoriasis. It's between 50 and 60% success rate. For the intestinal diseases, it's between 60 and 70% of success rate. But with this very, very low rate of side effects, we could offer the treatment to any autoimmune patient. And let's look, maybe you respond to it. For example, the type 1 diabetics. I have a couple of type 1 diabetics, children, who had their diagnosis a couple of weeks before they come in our clinic. And for those kids, we are successful, to treat them with high dose vitamin D and a carbohydrate restriction, and to make these insulin-free interval bigger than it normally would be. So one of the kids after 2 or 3 years still don't need insulin, and other kids need a little bit more, little doses of insulin, but compared to the average type 1 diabetics, it's less. And besides the success rate in treating the autoimmune disease, you need to understand, or the patients need to understand, that if you have an untreated vitamin D resistance, which you could see in this high elevated PTH, with sufficient vitamin D doses. That's our claim. If you have PTH elevated and you have a normal range of vitamin D, then you are susceptible of vitamin D resistance. And if you do not treat it and you have an autoimmune disease, then the chance that you get a second autoimmune disease is very, very high, or even a third or fourth. And this is what literature shows. An average autoimmune patient has not only one, has 2 or 3 autoimmune diseases. And that's what we could protect. So if you do not treat the autoimmune disease, we could at least protect them from getting a second one.